"Doc, I still love my wife. I want to be close to her, but I just can't." Those were the first words Mr. Harold said when he sat down in my office last spring. He was 67, retired, silver hair, strong build, clear eyes. But behind that confident look was a man deeply frustrated with his body. He wasn't lacking desire. He wasn't even dealing with classic erectile dysfunction. No, Harold's problem was complicated. He could get an erection, but it didn't last. He couldn't feel the same sensation when he climaxed. And worst of all, it burned every time he ejaculated. He thought it was just aging. His friends joked, "That's what happens after 60. But deep down, Harold knew something wasn't right. He felt betrayed. By his body. By the silence around this issue. By the idea that losing sexual joy was somehow normal. I listened carefully, then asked him one question. "When was the last time someone checked your prostate?" He looked surprised, then embarrassed. I'm not sure," he mumbled. "Maybe 10 years ago?" That moment, right there, was the turning point. Because what most men over 60 don't realize is this. Your prostate could be silently killing your sex life. Not your testosterone. Not your blood flow. Not your stress levels. But that tiny walnut-shaped gland, quietly inflamed or enlarged, sitting right at the base of your bladder. And for millions of men like Harold, it's the hidden villain behind sexual decline. It's not your age, it's your prostate playing tricks on your manhood. This is what I tell almost every man over 60 who walks into my clinic. In this video, I want to pull back the curtain. I'll show you how prostate health directly affects your ability to get and maintain an erection, how it changes the quality of your orgasms, and why even small changes in that gland can ruin your confidence. We'll also go into what BPH, benign prostatic hyperplasia, really does to your sex life. The signs to look out for even if you're not having urinary issues. And natural and medical ways to protect your prostate and your manhood, without pills that kill your drive. This isn't about shame. This isn't about selling fear. This is about giving you the truth. The kind of truth that might have helped Harold save years of silent frustration. And if you're watching this and feeling any of the same doubts, confusion, or pain, this video is for you. Drop your questions in the comments. Like and share if this feels close to home. And stay with me because what you learn today might just restore your confidence tomorrow. What is the prostate and why it becomes a problem after 60? Before we dive deeper, let's take a moment to understand what the prostate really is. Most men know it exists. Few understand how much power it holds over their manhood. The prostate is a small gland about the size of a walnut. It sits just below your bladder and surrounds part of your urethra, the tube that carries urine and semen out of your body. Its main job? To produce seminal fluid, the nourishing, protective liquid that mixes with sperm during ejaculation. So yes, it's directly involved in sex. But here's the kicker. Because of where it's located, any swelling or change in the prostate can block the urethra. That means it affects both urination and ejaculation. And starting around age 50, and even more after 60, the prostate begins to grow. This is called benign prostatic hyperplasia or BPH. It's not cancer. It's not an infection. It's just the natural enlargement of the gland as men get older. But just because it's natural doesn't mean it's harmless. BPH can press against the urethra, making it harder to pee. You may feel urgency. You may have to wake up at night again and again. You may strain to empty your bladder, but still feel like you haven't finished. And when it comes to your sex life, that pressure and inflammation can cause even more trouble. Painful ejaculation, weaker orgasms, less semen volume, erectile dysfunction that doesn't respond well to pills. Now here's what most men get wrong. They think sex and urination are two separate systems. But in reality they share the same neighborhood, and the prostate is sitting right in the middle of both. When your prostate swells, your urethra narrows. When it's inflamed, your pelvic nerves get irritated. When your bladder can't empty well, your sleep suffers. and low sleep means low testosterone. It's all connected. Let me tell you about another patient of mine. His name was Glenn, 72 years old, sharp mind, active man. He came to me not because of any urinary issues. He was there because he felt numb during sex. No joy, no sensation, just going through the motions. He had tried testosterone gels. He had tried ED pills. He had even gone to therapy with his wife. Nothing helped. Until we did an ultrasound of his prostate. It was nearly double the normal size. And he had no idea. The moment we treated his BPH, not with surgery but a combination of lifestyle and gentle medication, everything started to change. His energy came back. His confidence returned. And he told me something I'll never forget. "Doc," he said, "I thought I had lost my manhood. But it turns out I just needed to pee better." That's when I started telling all my male patients this. If your body still wants sex but it doesn't feel right anymore, don't blame your age. Don't jump to testosterone. First, check your prostate. Because very often the root of sexual problems is sitting right there, between your bladder and your pride. This is the sentence I want you to remember. You are not losing your manhood. Your prostate is just getting in the way of it. And here's something else to consider. When your prostate changes, it doesn't always scream. Sometimes it whispers. A slight delay in urination. A weaker stream. A little discomfort during climax. Easy to ignore. Easy to blame on stress or poor sleep. But over time, these small signs become big problems. That's why every man over 60, even without symptoms, should at least have a prostate check every year. Not just a blood test. Not just a casual chat. A real evaluation. PSA levels, physical exam, maybe an ultrasound. Because you can't fix what you don't see. And you shouldn't lose your intimacy over something so preventable. Let's pause here. Take a quiet moment and ask yourself, do any of these sound familiar? Are you waking up more at night to urinate? Are your orgasms less satisfying than they used to be? Do you feel something's off, even if you can't explain it? If yes, your prostate may be sending a signal. In the next part, we'll go deeper. How exactly does BPH impact your erections, your libido, and your partner's satisfaction? And what happens when you treat the prostate, but ignore the emotional toll? That's coming up next. BPH and its direct impact on your sex life. By now, you understand how the prostate sits in a critical location. But how exactly does an enlarged prostate, or BPH, interfere with a man's sex life? Let's break it down. First, we need to understand the mechanics of an erection. An erection is not just about arousal. It's a complex coordination of nerves, blood flow, hormones, and muscle control. And when the prostate becomes enlarged or inflamed, it disrupts this delicate system in multiple ways. Let me explain. When your prostate swells, it compresses the urethra and creates resistance. Your bladder works harder. Your pelvic floor becomes tense. Now imagine trying to get or maintain an erection while your body is in a constant state of tension and pressure. It's like trying to inflate a balloon while someone is pinching the nozzle. You might get partially hard, but staying hard, or feeling pleasure, that becomes a battle. Secondly, there's the nerve connection. Your pelvic region is home to an intricate web of nerves that control not only urination, but also arousal and orgasm. When the prostate is irritated, inflamed, or even just overgrown, it can disrupt these nerves. That can lead to less sensation during sex, sometimes even pain during climax, and in some cases, complete numbness. Let me tell you about Raymond. He was 69, married for over 40 years. He loved his wife, still attracted to her, still wanted intimacy. But every time he tried, he would climax with no feeling, no pleasure, just release. He told me, "Doc, it's like my body finishes but my mind doesn't." It broke his confidence. He stopped initiating. And his wife, thinking he wasn't attracted to her anymore, started to pull away. They were both suffering. And they didn't know the real cause. After some gentle questions, we ran a prostate exam. He had BPH with moderate nerve compression. Once we addressed it, things began to change. Slowly, naturally, but clearly. His words still echo in my mind. "Doc, the moment I started feeling again, I started living again." That's what many men don't realize. BPH doesn't just block your urine. It blocks your connection to your body, to your pleasure, to your partner. And even more silently, it erodes your self-worth. Now let's talk about ejaculation. A healthy prostate contributes to the volume and pressure of semen during climax. When it becomes enlarged or stiff, this function weakens. You might notice less force, smaller volume, discomfort, or even burning sensation. Sometimes the ejaculation becomes retrograde, where semen flows backward into the bladder instead of out. It's harmless physically but deeply disturbing emotionally. Men often feel broken, or worse, ashamed. And here's a critical piece. Many men with BPH are prescribed medications like alpha blockers or 5-alpha reductase inhibitors. While these can help reduce symptoms, they often come with sexual side effects. Loss of libido, difficulty ejaculating, even total erectile dysfunction in some cases. That's why you must work with a urologist who understands the balance. Not just treating your urination but protecting your intimacy. Because what's the point of fixing one part if another part of you dies in the process? This is the sentence I tell my patients when they hesitate about treatment. You're not treating your prostate just to pee better. You're treating it to love better, to feel better, to live fully as a man. And here's something else no one tells you. When BPH interferes with sleep, because you're waking up 3, 4, even 5 times a night, your testosterone levels start to crash. Testosterone is restored during deep sleep. Poor sleep means poor recovery. And that means less drive, weaker erections, and higher emotional stress. So in a strange twist, your prostate affects your hormones, even without touching your testicles. Now let's add in the emotional weight. When sex becomes disappointing or painful, men don't just feel frustration. They often feel failure. It can trigger anxiety, shame, withdrawal from their partner. This becomes a vicious cycle. Painful sex, avoidance, distance in relationship, lower desire, more dysfunction. And all of it could begin with an inflamed prostate. That's why, as a urologist, I always say, erectile dysfunction is often not just a vascular issue. It's a symptom. And BPH is one of the first culprits I look for, especially in men over 60, because it hides in plain sight. Let me end this part with a question I ask my patients. What if the reason your sex life has changed is not because you've lost your desire, but because your body has been asking for help, quietly, respectfully, for years? Wouldn't you want to listen? In the next section, we'll dive deeper into those quiet signs, the subtle ways your body warns you, and when to finally step into the urologist's office, not just for your health, but for your happiness. Warning signs and when to see a urologist. Not all problems scream. Some whisper. And the prostate is one of the best at whispering, especially in the early stages. Most men expect big red flags. Pain, blood, total dysfunction. But in reality, the signs that your prostate is beginning to interfere with your sex life are often subtle and easy to miss, or easier to ignore. Let's go through a few of the most common warning signs I see in men over 60. And if any of these sound familiar, it may be time to stop waiting and start checking. The first is urination changes. You may notice your stream is slower, or that you hesitate before the flow begins. Maybe you start waking up more often at night, once, then twice, now 3 or more times. You might finish urinating, only to feel like you didn't completely empty. These signs are not always dramatic, but they are significant, because an enlarging prostate doesn't come with sirens. It comes with inconvenience, with small frustrations, with changes you write off as getting older. But age doesn't cause you to lose bladder control. An unmonitored prostate does. Second, pay attention to how sex feels. As climax become less intense, Is the volume of semen lower than it used to be? Is there a slight discomfort or burning sensation when you ejaculate? Do you feel mentally ready but physically let down? That emotional mismatch, when your desire is strong but your response is weak, often signals a physical block. And in men over 60, that block is often prostate-related. Here's a story I'll never forget. A 64-year-old man came into my clinic last year. He looked nervous, ashamed. He said, "Doc, I haven't had sex with my wife in over a year. She thinks I don't want her. But I do. I just don't feel anything." We ran tests. His testosterone was fine. Blood pressure good. Heart strong. But on exam, his prostate was firm and enlarged. We treated it. 3 months later, he came back smiling. He said, "We made love last weekend. For the first time in a year." She cried. I cried. It felt like coming home. That's when I knew this truth must be said out loud. Prostate problems don't just affect the body. They quietly damage the soul of a relationship. And yet, so many men delay seeking help. What? Shame. Fear of exams. Believing it's just aging. Or the deadliest belief of all, I can live with it. Yes, you can live with it. But will you thrive with it? Will you love fully, feel deeply, sleep soundly? This is the turning point. If you're experiencing any of these signs, it's time to visit a urologist. And no, it's not about getting poked and prodded. Modern prostate exams are quick, often non-invasive, and extremely informative. Might involve a PSA blood test, a digital rectal exam, DRE, ultrasound imaging, urine flow test. Each of these gives us a clearer picture, not just of your prostate size but how it's affecting your life. Here's the most important thing. You don't need to be in pain to deserve help. You don't need to wait until sex becomes impossible. You don't need to let this silent enemy chip away at your confidence. If you feel like something is off, even slightly, listen. Because the earlier we catch it, the easier it is to treat. Sometimes all you need is a change in lifestyle. Other times, natural supplements or light medication. In rare cases, procedures, but even then, minimally invasive options are available now. You have choices. You have control. But only if you choose to act. Let me say it straight. You're not too old. You're not over the hill. And your best days of intimacy are not behind you, unless you decide to leave them there. Your manhood is still yours. But you must protect the things that protect it. And your prostate is one of them. Let me close this section with a thought I share with many of my patients. If your car engine started making a strange noise, you take it in. Not because the car is broken, but because you care about it, because you want it to last. Your body deserves at least that much care. Especially when it comes to the parts of you that define connection, love, and identity. So ask yourself, is it time for your checkup? If the answer is even a maybe, then yes, it is. Coming up next, we'll shift gears. You've seen the problems. Now I'll walk you through the natural and medical ways to support your prostate and reignite your intimacy without drugs that drain your drive. Let's take the power back. Your manhood didn't fade, you just stopped listening to your body. We've covered a lot. You've learned what the prostate is, why it changes with age, and how those changes, though often silent, can echo through every part of your intimate life. We've talked about BPH, benign prostatic hyperplasia, and how it presses on your urethra, irritates your nerves, and interrupts the natural flow of both urine and desire. You've heard stories of men like Harold, Glenn, and Raymond. Men who loved deeply, still wanted connection, but felt disconnected from their own bodies. Until they realized it wasn't aging. It was their prostate, quietly demanding attention. And maybe you see yourself in those stories. Maybe your sleep is broken. Maybe your erections aren't what they used to be. Maybe you've started avoiding sex not because you've stopped wanting it, but because it just doesn't feel good anymore. That's not weakness. That's your body trying to talk to you. And here's the truth. Manhood doesn't fade because of time. It fades when we stop listening to ourselves. when we accept pain as normal, when we ignore discomfort because we're told it's just part of getting older. But that's not the full story, because there are men in their 60s, 70s, even 80s who still enjoy deep, satisfying intimacy. Not because they're lucky, but because they took care of the foundation, their health, their hormones, their prostate. So let me leave you with this. If your body is whispering, listen. If your confidence feels shaken, ask questions. If your connection with your partner feels distant, start with understanding your own anatomy. You don't have to suffer in silence. You don't have to fake it. And you certainly don't have to give up. You just need the right support, the right information, and sometimes a gentle push to walk into a clinic and say, I need to understand what's going on. That moment can change everything. So what now? Take a breath. Reflect on what you've learned today. If any part of this felt close to home, don't brush it off. Talk to your doctor. Schedule a prostate exam. Ask the questions you've been avoiding. You owe it to yourself and to the people who love you. Leave your thoughts or questions in the comments. I read them. I respond. I care. If this video helped you, please like it, share it, and subscribe for more conversations like this. And remember, your prostate may be small, but the way it affects your life, your joy, your confidence, your connection, is anything but small. Take care of it, and it will take care of you.